Dear friends, my name is Dr. Ashok Seth and I'm the chairman of the Fortis Escorts Heart Institute in New Delhi. Today I'm going to talk to you about prevention of heart disease, but more importantly, on the World Heart Day, we need to be more aware of our hearts and clearly understand how doctors are treating us and what's the advantages of those treatments. Today I'm going to discuss that after a heart attack, when you go home, you'll find yourself on a number of medications. And often you feel, I went in, I had a procedure, I had a heart attack, and now I'm on multiple medicines which I never was on before. Well, all those medicines are important. In addition to the blood thinners that you would be on, the most important medication from there on, after a heart attack or even severe chest pain for which you've been admitted or an angioplasty procedure, is going to be lowering your cholesterol with a drug called statin. For us, cholesterol lowering becomes the biggest mainstay of treatment. And we have our own levels. We know as Indians that we are more predisposed to coronary artery disease than the West, and we have a higher tendency of having a heart attack. Therefore, we want to lower our LDL cholesterol to extremely low limits. Our target for any patient who's had a heart attack is get the LDL cholesterol at least 50% of his baseline and to less than 50. In fact, I would say anybody who's young, diabetic, or has had previous heart attacks, or has a strong family history, I would lower it to even less than 40. So the number of 50 and 40 should stick to our mind. And that is done by a drug called statin, which you would be prescribed along with a tablet called ezetimibe in the initial stages. What has been shown is that if we get your LDL cholesterol, our cholesterol down to that low level after a heart attack, we prevent recurrence of heart attack, we prevent future events, we actually prolong our life. So we've got to be as aggressive as possible right from the day of the heart attack, and in 6 weeks, achieve these target levels. By the way, at 6 weeks, when the blood tests are redone and the doctor would redo them, if the LDL cholesterol levels are not down to these target levels, then there's a further drug which is going to be added, a drug called bempedoic acid, which would be added to statins and ezetimibe. And again, within 4 weeks, a blood test done to see whether we've reached those target levels of less than 50 in everyone and less than 40 and 30s in ones who are extreme high risk. And if that is not achieved, we would then be started on an injection. These are called PCSK9 inhibitors. These are injections which are very effective in lowering cholesterol and lowering LDL cholesterol. We also look at other risk factors, of course, diabetes, control of high blood pressure, and those are equally important. But we also look at a level called LPA in the blood and ApoB, so that we are able to target them in a comprehensive manner with the strategy that I've evolved for you. Statins, high dose immediately, ezetimibe immediately, bempedoic acid at 4 to 6 weeks visit, and perhaps PCSK9 injections, so that we achieve the target levels and avoid future heart attacks and prolong life for all those who've had a cardiac event in their life. So I hope this has been beneficial to you, and I hope that you will actually now maintain compliance with those medications and not question the doctor as to how many medications he's put you on. It's all for your own good. Let's prevent heart attacks on this World Heart Day.